on the lawn gatherings at our church at Trinity. And so I just wanted your opinion, Doctor, on we gather when things are open up again on our lawn. Particularly the seniors are so lonely. What's your advice around, of course, spacing, but even when we're on the lawn, should we be wearing masks? And that's what we've been doing even when we opened back at Easter, when we had good weather before the lockdown. Can you have a comment on that?
Sure. So I think looking towards when we're able to gather sort of after the stay-at-home order we're in right now is lifted, the question is always, how do you do so as safely as possible in a way that doesn't increase risk for COVID to transmit from person to person? Being outdoors is actually one of the most important things you can do. We had a sense early on, about a year ago, but we have even more evidence now about how difficult it is for COVID to transmit outdoors compared to indoors, given how good the ventilation is outdoors, even with something like a gentle breeze. Yeah. And also when people are outdoors, it's easier for people to kind of distance and space themselves out more naturally. Whenever you're indoors, you're inside a confined space, you have to actively think about, how do I move? Where do I stand to make sure I'm keeping 2 meters? Whereas if you're milling about outdoors, it's naturally easy to distance. And those factors, I think, reduce the risk overall. It doesn't bring it down to zero, but it does significantly reduce the risk of transmission. What we usually say is, if you're outdoors, you want to maintain your distance. And if you're in positions where maintaining a distance is going to be challenging, that's when you want to think about wearing a mask. Okay. So if you can tell yourself, I'm for sure able to stay distant, I'm for sure able to stay outdoors, wearing a mask is not the most important thing in the world, but we know that isn't easy necessarily to maintain. People sometimes, they'll start out 2 meters out and they'll get closer without thinking about it. And so it is worth wearing a mask if it's going to be difficult to maintain. And even if you don't think you'll need a mask, bring one along, because you never know when there's going to be a crowd or when circumstances are going to change, when you need to go inside without having it planned in advance. So at the very least, bringing a mask is worth doing in those scenarios.
Bring a mask. And my last one, this is probably too difficult to discern, but a lot of people are saying September, maybe we'll be back in church in some fashion. And I have other people saying, well, we'll be lucky if it's Christmas. Do you have any comment on that?
I guess, I think there's a wide variety of opinions out there. And I think there's a lot of uncertainty, which is why there's so many opinions. I'm perhaps a bit more on the optimistic side of the spectrum. I see the incredible progress we're making in vaccinating our community locally and as a province and as a country. And I'm thinking about when the fall begins, where are we going to be in terms of our vaccine coverage? What impact will that have on our case numbers? And what impact will that have on the residual risk of COVID transmission? Yes. I think that if we are where I hope we're going to be, we might be able to have a more normal fall. I hesitate to say anything with certainty because you can't hold me to it. Yeah. But with some luck and some hard work over the summer, if we're able to do the things now that keep numbers down, get vaccines into arms, we might be able to have some gatherings in the fall that we couldn't have over the past year. We'll have obviously a better sense when we get closer.
Yeah, thank you very much for that hope and optimism. So, okay, sorry, I got to go get my son, and I won't put him on. He'll be too drugged, but thanks so much, okay?
Thank you.
See you, John.
Thanks, John. And that was John Benham from Trinity United asking some of those questions. Maybe that was actually going to be my last question, Doctor, but maybe we could go a little deeper in that, just related to the, we're all in the hope business, so we're looking for that hope. And I won't hold you to it. Maybe others will, but yeah, I like what you're saying. Like if the vaccination thing tracks fairly well, maybe the fall will look a little better. Mm-hmm. And so, I mean, I guess for faith communities, it's like, should we be planning for a virtual Christmas, Eid, or Diwali, or whatever we do around that season? Do you think December might be a thing that some in person? And I guess maybe the clarifying factor of that is, when we say that, are we really talking about still very likely by the end of this year still having restrictions on how many people you can have in a faith community space, in a sanctuary or wherever? Like what our indoor gatherings look like will possibly still be restricted. What are your thoughts on that?
I mean, my rule in life is hope for the best and sometimes prepare for the worst. And so I think it is prudent to prepare for a possible future where we do need to have virtual gatherings, for example, at Christmas. And, you perhaps want to plan for both scenarios of being able to do in person or virtual, but because we don't know, we want to prepare for all possibilities. as you said, obviously we'll know more as we get closer, but I think if you look at jurisdictions elsewhere in the world, and in my mind, the prime example is Israel. Israel is a fairly small country population-wise. They have the highest or among the highest vaccination rates per capita. So they are well ahead of many other countries in the world in their numbers of vaccine doses administered. And if you actually followed their numbers of their case rates, you could see as they were immunizing, especially the older adults and getting really high rates there, you saw their epidemic curves really separate out. And the trends among the older cohorts that are vaccinated were much different than the trends among the younger cohorts. And of course, as they worked their way down to younger cohorts, the overall trends got better. And so that's actually a really good real life example of how when you get the numbers of vaccines up, you do see the reduction in risk. And that facilitates relaxing the measures. And they've begun to relax some of their measures they had in place because they had some pretty strict measures in place for some time. And I'm anticipating that given where they are now, they're probably going to be able to stay relaxed, although I don't know for certain. And I'm hoping that maybe by the time we get to the fall or winter, we'll be at a place where we have comparable levels of coverage. It does really depend on how successful we are and how high we can get that number of our coverage. Right now, we are in some ways a fortunate position that we have so much demand and interest for vaccines that we can't always keep up with the supply. Vaccines have been scarce, and we had to make the best use of them that we can, but there's always more people who want vaccines than we can give vaccines to. We know it's eventually going to change. As we get more vaccines in these coming months, we're eventually going to get through the people who are quote unquote low-hanging fruit and have to do more work to convince people who are more hesitant or who are not as keen on getting the vaccine to get the vaccines. And that's going to mean the progress is going to continue, but perhaps at a slower pace. And it's going to be challenging once we get to 70, 80, 90% to get the people who are left, because they're going to be the ones who haven't gotten it yet. So we'll see where we are as we enter the fall and winter, but that'll be something we look to. And as a province, I know that we're looking at sort of immunization coverage rates overall as one of the metrics that might guide recommendations going forward.
Right. Okay. So, sorry, go, Bruce, did you want to say something?
Yeah, I guess what would be helpful for me, I was reading this CDC recommendations in the US, and one of the, this would be a question for later about singing and music. And one of our challenges is for us is that we have a fairly musical community, and they're really longing to do that again. So that's a preamble, and we'll get to that later. But I was noticing in this CDC recommendations for the US that they felt what they said was vaccinated. They felt that people could return to worship and maybe even sing if they were vaccinated, wore a mask. I think that was it. But someone who was unvaccinated was still at a fairly high risk. So that's how they described it. But what they didn't say, when they say vaccinated, are they meaning the 2 shots? Would you see it as a full vaccination? Or I guess when you were looking at conditions for fall, that's kind of where my question was going. Are you thinking fully vaccinated is when measures might return more to normal, or just first dose vaccinations?
So beginning with the CDC, because the US took the approach of giving the second dose, 3 or 4 weeks after, according to the product monograph for the vaccine, they have many more people in their population who have 2 doses of vaccine compared to Canada, where we have relatively few. And when the CDC issues guidance about what vaccinated people can do, they are talking about people who've gotten both doses.
Okay.
And in general, they also say you got both doses, with the second dose being at least 2 weeks ago. The idea being that it takes each dose takes a couple of weeks before it kicks in and is fully offering its protection. So we're not going to be in that position quite yet, but again, we are at a point where we're getting a lot more vaccine supply in, and some of the people who got their first dose in, say, March are going to be coming up for their second dose pretty soon, because 4 months from March is July. And as more vaccine comes in and we're able to scale up and get many more first doses into arms, we might even be able to shorten that 4-month interval and begin giving people their second doses, 3.5 months later, 3 months later, depending on exactly how we're doing with supply and demand. So I think that is the context in which we are operating, and hopefully by the fall we'll have a good chunk of our population that has 2 doses, but we're obviously going to have many more people who have had 1 dose. And the the difference in the context, I think one of the reasons that the CDC's guidance is, I'm going to call it a bit more liberal, a bit more open to activities than the provincial guidance in Ontario, is because of the fact that not only do individuals have 2 doses in many cases, but at a population level, you have much higher 2-dose coverage. When we think about the protection that a vaccine offers, we can kind of think of it at 2 levels. There's the individual level protection. If I got the vaccine, if I got 1 or 2 doses, I have this personal protection and the protection to those immediately around me. But then at the second level, you can think about what is protection offered to a community when a particular proportion of the community has 1 dose or 2 doses. And as you look at those things, they help us guide when do we relax individual level public health measures like recommendations around distancing and masking and all of those, versus when do we relax community level public health measures like restrictions on what kind of businesses can operate, restrictions on gatherings, things like that. So it's a bit of a long-winded and meandering answer, but I think that once we get more of our population immunized with 2 doses, we might see some guidance evolve to be a bit more like what the CDC has, but our context right now is quite different than the US context.
Sure. No, I'm very helpful. I think because sometimes people will quote, at least in my experiences, they go looking for what they want to find. And so if they say, oh, look, we can do this, look at they do this in the US or do that. I mean, just like your example with Israel, always looking for someone who's a little bit further ahead of us. What are they doing? What they're not. But sometimes what we don't know is the conditions under which they were based those conclusions or decisions. And so that's really helpful for me, because then we can say, yeah, hey, we need these conditions in place before that will take the place. And I think part of I think John will probably be hitting on this too, but for me, we're always walking the line between those who feel a little bit more inclined to take some risk and those who are less inclined to take any risk. And right now the government makes it really easy for us because they told us we can't really meet. So it really takes the decision making out of our local hands, which is in some ways much easier for us because I don't have to deal with all the broad opinion. But at some point as we move forward, we're going to navigate that, right, where you have these different opinions about what's safe, what isn't safe, and I mean, we've been fairly careful, but I know that people are also growing weary. So anyways, thank you. I really appreciate the background. That's always helpful to know how we base a decision. So great.
That's no problem. The other thing I'll just add is, of course, there's different circumstances around the world, lead to different recommendations, but there's also, it's not like there's one circumscribed right answer or right approach. It's really more of an art than a science. And, there are different approaches taken in different jurisdictions based upon their own factors, but also based upon, their own risk tolerance as a jurisdiction and how they see a particular set of recommendations being implemented. And there's no one size fits all. And that's why there is a lot of diversity in the kinds of measures we're seeing. And it's in some ways, it's not surprising to me because we're all learning about how best to manage COVID and how to best balance that risk in our communities.
Well said.
Yeah, and I'd say just as a follow-up to what you're commenting there, Bruce, like what we've tried to do at St. Andrews in Guelph is lean into the more local directives from our own public health unit, or if they don't quite have all the documents ready to go and all the things outlined, finding another jurisdiction within the province that has some things to offer. So we've leaned into like the Toronto Public Health Unit, and certainly there's been great resources from Wellington, Dufferin, Guelph Public Health specifically for churches. As with anything, just like lawyers and everything and how we look at things, sometimes I find within my own congregation, people are looking at it and saying, well, it's saying this, but doesn't that mean we could still do this? And it's like, you know what, we're going to follow as tightly as we can the ways to keep everybody safe. And I've consistently said the messaging I've consistently put out there is part of our role as a community group or organization needs to be a good example in the community. So when the government does a stay-at-home order, I go and do a live broadcast with a tech team that's sitting in the balcony of a massive sanctuary and an organist who's playing the organ. There's 4 of us in our building. I would be certainly happy to do it from my home, which I'm doing today, But I think when the government, so anytime someone says, oh, can we, the government says we can have 10 people, or the government says we can have 30%, I'm like, it's a stay-at-home order. I think what they mean is stay at home. So it really seems irresponsible for us to bring 10 people to the building when we can do that, or they say we can do that. But let's try to be a good example. So I think that's really helpful. Following up on the second dose piece, I did have a question from another faith community leader who was saying that some in their congregation are a little worried and anxious about getting their second dose through the public health unit. And again, now that we've got pharmacies involved and other things, everybody's got diverse stories. So I had my first dose, thank you very much, from the public health unit, extremely efficient. It was awesome, a great experience. My wife had her first dose at our local pharmacy. I was given the documentation that you get through the public health and was told that I would receive a phone call for my second dose. She received an appointment from her pharmacy. So she has an actual appointment in August, a specific day, time. That's where she's supposed to get her second dose. Can you speak to helping folks to know when they might get their second dose? They don't want to miss it,
Yeah.
Which is good.
And I know that for our clinics, there's going to be more information coming shortly about second doses and exactly when they should be expected. We're telling people, it's going to be within 4 months, and it might be towards the longer end of that, only because there's all this uncertainty about exactly when we're going to get a vaccine supply and how that's going to match clinic capacity and the demand for appointments. Whereas other sites might book a second dose appointment, I think with an understanding that they might modify it. And at least with our mass immunization clinics, we want to always have them full so that we can churn through as many doses as quickly as possible. And so that means we will pull people forward if they have an appointment that's later, and if we can see them now. So that's part of the reason why more recently, people who've come in for their first doses haven't gotten a specific date and time. It's because we kind of knew that that date and time was not going to be the date and time, and it made more sense to book it once we had a clearer sense of when those people could expect it. And because we are getting a bit more clarity now with our anticipated deliveries of the Pfizer vaccine, for example, we're going to be able to begin calling those people back and saying, here's when you can book in, or here's when you can expect your second dose with more concrete detail. Mm-hmm. With pharmacies, it might be a little bit different because I'm not sure whether they're booking it with an understanding it's going to be delivered in that pharmacy, even if it may not be. Like, there's a possibility people who get their vaccine in one setting might get their second dose in a different setting, depending on what the second dose is. One of the challenges right now is, of course, the pharmacies have been using the AstraZeneca vaccine, which we received some supply of as a community this spring, but where there's been much less certainty about future shipments, both timelines and quantities. And so one of the questions people have had quite reasonably is, when can I count on getting my second dose? How can I be reassured I'm going to get a second dose on the approved schedule? And right now, there's some work being done through some scientists in the UK to look at the science behind whether people who receive the first dose of one kind of vaccine can receive their second dose with a different vaccine. So for example, if you received a first dose of AstraZeneca, could your second dose be a Pfizer or Moderna, or vice versa, or using other vaccines to mix and match? Usually our advice is, if you get the first dose of one vaccine, complete your series with the same vaccine. It's our default for some good reasons. But there is some interesting science about potentially having a broader immune response if you actually have different vaccines for doses 1 and 2. And the idea behind it is that because each vaccine kind of challenges your immune system in a slightly different way, it trains your immune system to have the ability to respond to a more diverse kind of threat, because it's seen COVID-19 in multiple forms. That's oversimplifying it, of course, but that's the idea behind it. And so there's some studies looking at that in the UK right now. I think they're going to have some data for us potentially as early as June. And I've also heard that NACI, the National Advisory Committee on Immunization, is going to be offering a recommendation in the coming weeks about what it says might be reasonable to do in our context in Canada. So we might see, for example, people who got their first dose at a pharmacy, they might be invited to get their second dose at one of our clinics, depending on what vaccine they're getting and where it can be best delivered to them.
Okay, that was kind of the follow-up I was going to ask. My wife got hers through our local doctor, and I got mine through you folks. And she wasn't sure where she should go for the second. And the feeling was the doctor said, no, come back to us for now. So I guess that could be our best advice to people, is if you got it done at a pharmacy or your local doctor or the health unit clinics, look to do your second shot with those folks for now,
Yeah.
until we hear differently. Is that
Yeah,
a fair?
Yeah, I mean, in our clinics and at the clinics that we work with, including our partner clinics, primary care pharmacies, we always say, whenever you see someone for their first dose, think about their second dose, plan for it, develop some sort of arrangement about when that person can expect to come back in.
Right.
But of course, as the circumstances change, if there's, for example, going to be a need to give them a dose of Pfizer, and that can only be delivered at these clinics, then that means that the plan will change. And we're just trying to get everyone thinking about the fact that things will change. And while you want to plan for this, you might need to change it. And that's just the nature of the dynamic situation we're in. There is the possibility that Pfizer might be delivered in pharmacies. I know there's pharmacies in Peel region in Toronto and some of their hotspots that are currently piloting the Pfizer vaccine. There are also pharmacies that are going to be soon piloting the Moderna vaccine in places like York region, Windsor, Essex, Durham, and some other parts of Ontario. And so we might see the ability to deliver these vaccines in pharmacies as well, for example. But these things are all changing quite quickly, and people should expect that what they think might happen today for the second dose might be different than what happens when the second dose time comes up.
And I really want to offer just a moment of gratitude and appreciation and acknowledgement, Doctor, for just that reality in itself, right? That everything from the start of this whole thing way back when to now is a constant evolution, change. Things are different, because I find that, we in the general public have a lot to say about the diversity. We are now a much more well-informed community. I mean, it's interesting, look back to 1919 when there wasn't as much maybe public knowledge about some things, but there were still folks who were offering a differing opinion from what the government was offering or what the public health was offering. But just that acknowledgement of like, you guys are like, the whole scientific community and the health community are constantly studying and researching, and things are coming up that are new all the time and are having to adapt, and that lovely word pivot in everything that's going on. And just for all of us, maybe this is a fantastic lesson in just being adaptable and changing and being okay with some of that, and doing the best we can for the knowledge we have in this moment, but realizing our knowledge might change and we might do the next best thing in the next moment. So thank you for that. And wow, what a whole bunch of things you guys are juggling all the time. Can you give the briefest of answers? There was this in the same vein. Can you give the briefest of answers relating to the countering the vaccine preferred conversation? I think you've already spoke to it a bit, but can you? I'm inviting you to give us the briefest of answers related to that.
Sure. So this whole issue of preferred vaccines comes out of some communication that was done earlier this week by the National Advisory Committee on Immunization. And essentially, they are a group of experts that offer recommendations to governments about how to make the best use of the vaccines to have the biggest public health impact. So long before we talked about preferred vaccines, we were talking about, for example, how to make the best use of having a limited scarce supply of vaccine. And it was this National Advisory Committee, NACI, that made the recommendation to governments about spacing out the dose interval to up to 4 months. And so they look at the clinical trial data, they look at vaccine safety data, they look at real world evidence, and they try and make best recommendations about how we can make the most out of our vaccines. With the evolving recommendations, if you actually look at their guidance statements, they have been talking a bit about the importance of considering the risks and benefits of vaccines. We have been saying that the most important vaccine for you to receive is the first one that you're offered, because of course, getting a vaccine now protects you as soon as possible. And of course, we don't want to have anyone in our community who's not protected if they're eligible to receive a vaccine. One of the things we have been learning about as the vaccines have been rolled out is a rare complication that comes up with the AstraZeneca vaccine, and which has also been seen with the new Janssen vaccine, the Johnson & Johnson vaccine. And that's, it's called VIT. It stands for Vaccine-Induced Immune Thrombotic Thrombocytopenia. Big, long medical term that basically just means blood clots that we think might be linked to a vaccine. And the idea is that some people who get vaccines, they have gotten sometimes significant blood clots that, they're not necessarily benign. They can actually have some fairly significant impacts, require that person to go to hospital. In some cases, people have died with these blood clots. They're exceedingly rare, and they, are something that we need to consider and talk frankly about, but they are exceedingly rare. And I think that while we have been engaging in a conversation about the importance of recognizing the benefits and the risks, it's been important to contextualize those a bit better. When NACI put together the recommendations, they, in their 70-odd page document, had a really robust analysis looking at the risks and benefits and trying to weigh them for those vaccines. The idea being that depending on how frequently that complication comes up under different assumptions, and depending on how common COVID is in the community and how likely someone is to go to hospital for COVID, you can try and compare, the risks of getting a complication from the vaccine, which is quite rare, versus the risks of staying unvaccinated for longer and therefore being exposed to COVID and having the complications of COVID. The long and short of it is that, of course, the risk benefit varies depending on how common we think the vaccine complication is and how common COVID is. But in our context in Ontario and in WDG, we have high levels of transmission. We're perhaps coming down from the peak of our third wave, but we are still in a third wave. And if you do the risk benefit calculus, the benefits of getting the vaccine outweigh the risks for our context. And I want to reassure people who got the AstraZeneca vaccine that they did the right thing to protect themselves, to protect their families, and protect their communities. And I hope that no one feels any sort of buyer's remorse about their decision, because people who got AstraZeneca absolutely made the right decision. I do know that going forward, we're anticipating that, much more of our supply is going to be the Pfizer vaccine. And as I mentioned, there's a lot more uncertainty about when we're going to get AstraZeneca. So in some ways, it might be a moot point on the go forward basis. But all of the vaccines that we have now, they have been approved by Health Canada. They're considered safe. They're considered effective. And we've been, trying to make sure we're communicating about this rare complication in a way that makes sense and hopefully doesn't undermine people's willingness to get vaccinated when that's the right thing for them to do, which it is in our community right now.
I really appreciate that, Doctor. Thanks. And you don't have to respond to this editorial comment that I'll offer, because I know this is recorded and I'm hoping people will see it. But there's in my observation, the sense of what we're experiencing right now is there is something beautiful about the level of transparency and openness of all the information we have at our fingertips just by typing into a search engine. But I have not read the 70-page report, nor if I began to read it, probably would I even understand most of what's in it. And we do have a media engine that drives clickbait and talking points and wants to offer those up. And then people speak with authority, as Bruce had mentioned earlier, around, well, there's this report from this organization that says this. And it's like, but you haven't done the deep dive and you don't have the knowledge base to really know what's going on. And being one representative of a faith community, and I know many other faith communities that have, say, for example, a sacred text that's incredibly long, pulling one tiny piece out of that and using that as a generalization for everything without the context and without a larger background is not the most and best way to move forward. So again, I acknowledge the challenges you guys have around a little bit of the politicization of some things and also just this desire to share information, but sometimes it's not the most helpful, right, in our community, unfortunately. Let me move on to a couple other things. Really wanted to get into, John from Trinity United asked the question about outdoor gatherings. A number of people in the faith community are wondering about, once people are vaccinated, and if we're looking at maybe by the fall, there could even be double dose vaccination, because I actually do have friends in the US who are double dose vaccinated already. They're going to work with other people who are double dosed, and they're apparently working in a similar space, keeping some social distance. But it's really this question of, I'm having a sense within my faith community that once everybody is double dosed, we can just get back. And so it's a question of, what do you think the protocols will be? What will be the recommendations likely? Just, again, we're not holding you to it absolutely, because things are changing every single day, but what's your best guess on what we would need to do as a community if we're going to have in-person gatherings again? Recognizing that even through this journey, some churches have already had in-person gatherings of that, 30% limit. St. Andrews hasn't had any of those gatherings since March of last year. So just sort of curious about that. And then the second piece of the question, that we can get to as well is more on the individual side. You know, can we do visits? Can we go to hospitals? Can we go to long-term care? But maybe hold that for a second. Let's just talk about the wider community.
So I think that, of course, the guidance on that's going to be forthcoming once we get as a community to a place closer to that. But what I think we're going to see, my best estimation is that we're going to see a sort of gradual and stepwise movement from where we are now to the new normal, or whatever our normal looks like post-pandemic. And I think that the relaxation and different kinds of measures will be based upon both the immunization status of the people who are participating, for example, in a gathering, as well as the broader immunization status, the immunization level in the community. So I think both of those, this individual level and the community level factors, are going to play into the recommendations. And, we might see, at first we're allowed to, have this quantity of people gathering in this setting, and then it's going to be loosened and loosened and loosened as we make sure that we're kind of loosening things, watching to see what happens, making sure cases don't spike up, and doing so in a responsible manner. I think we're all thinking about the possibility of moving too quickly. And we just came out of a really challenging third wave. And for the hospitals, for example, they're still very much in the third wave. I don't think any of us want to see a fourth wave. I think this really has to be the end of it. This has to be the last wave. We can't keep going like this. And we want to make sure that we set ourselves up for success to enable us to move consistently in a positive direction, even if that is a little bit slower. We don't want to yo-yo. We don't want to have our community go into and out of restrictions. I think it makes more sense to gradually relax and then, pause if we need to pause, because we have evidence to say things are not going well. But better to move slowly in the right direction consistently than to move back and forth and to find out we moved too far and create a risk that we weren't ready to manage. So I don't really have any further knowledge about what to expect beyond that. That's kind of my general sense. I do think it's going to be gradual, and it's going to be measured, and it's going to reflect the progress of our immunization campaigns.
And would you say, if I think you touched on it earlier about people who may not be vaccinated, and vaccination is a choice for everyone to make, but would the advice be maybe in the similar vein of somebody who's immunovulnerable or compromised? Public gatherings might not be the best place for them to be at, in a general statement, but should faith communities be thinking about offering at least a kind of advice to their communities, saying, if you've not been vaccinated, we would actually not recommend that you join in-person gatherings? Because I'm assuming that almost every faith community is probably going to continue having a virtual option. I think we're all going to be asked and requested, and that'll just be what we're going to be doing. Would that be your best advice for somebody who hasn't been vaccinated?
I think that is worth thinking about. I know that there are going to be some people who choose not to be vaccinated. And of course, part of our job is to try and keep that number as small as possible and to do the legwork to make vaccine hesitancy go down and to address the factors behind vaccine hesitancy. When it comes to people who can't get the vaccine, right now, there isn't really anyone who can't get the vaccines that we have available. With some vaccines that we offer outside of COVID, there are some people who, for medical reasons, they can't get the vaccine, and they benefit from the fact that others around them are immunized. With these vaccines, they can be used quite broadly. And while we are still learning about whether some groups who get the vaccine might have less of an immune response and might still have suboptimal protection even after the vaccine, we're still learning about that a fair bit. And it seems like even some of the groups that don't respond super well to one dose, they do respond reasonably well to a second dose. But we want to know a lot about how long that protection lasts for them. Do they need boosters? Do they need other kinds of protections in place? And how does their level of protection compare to someone else who doesn't have a medical condition? All this to say, we're still doing a lot of learning. And as we perhaps gain more wisdom about that, we might be able to offer recommendations about people who've gotten the vaccine and have X, Y, or Z medical condition. They perhaps should take these measures still to modify their own risk exposure. We're not quite there yet. We don't know enough yet, but I can see a future where we have that. And I think that'll be really important to incorporate in the guidance we offer and the ways that congregations choose to organize.
Yeah, and it's interesting. I think it plays into the other statement you'd made earlier about my observation of what we've been journeying through is we sort of have these arbitrary, in our minds, we have these arbitrary times. Like I think John had mentioned, or someone had mentioned September in the part of this conversation earlier on. It's like, well, what's going to be really different in September? Well, maybe everybody that's associated with our congregation, or a great majority, are going to be vaccinated, double dose vaccinated. Okay, so then September is just going to be what we're going to do things, and whatever the guidelines are, we'll be able to do. But the piece that's missing in that is, that means that, say a large percentage of our congregation is double vaccinated by September. All that means is those people have been double vaccinated, but there's been no sort of longevity of research. You're using other countries and other examples of what that looks like, but all of that takes time to sort of get to figure out what all that means. Like, our best guess is double vaccination is going to be good, and people, that's going to be helpful, but we don't know all the stuff around that. So just again, to highlight that for folks, like when other guidelines start coming out in the fall, even though people have been double vaccinated, I'm sure there's people going to be saying, but I thought I was good now. Why do I have to do this? And it's like, well, what we've learned is people who are double vaccinated, these are the things you still have to do, right?
Yeah. And sometimes you get questions, for example, about, how long the immunity lasts from the vaccine.
Right. Yeah.
The vaccines only existed for about a year, so we only have that level of time to look back at. Mm-hmm. And as we, continue to move along, we're going to learn a lot more about the kind of protection it offers, the duration of protection, whether or not we need boosters, if so, on what frequency, and what kinds of things the boosters need to contain. It wouldn't surprise me if we do need to offer boosters. To me, that seems like a likely outcome. But we don't know whether it's going to be something that is like the flu vaccine, where you get something annually, or there's a lot of uncertainty about exactly what the long-term immunization needs are going to be. But we'll be communicating that as we learn more as a scientific community.
And I'm assuming Bruce had mentioned it before, just from that communal perspective, I'm assuming things like singing and music, we're not really sure yet 100% of what we might be allowed to do. My assumption would be that the guidelines that have been in place for the past year, when we have been able to gather in person, probably will be similar. I'm not like, I don't know, but you're the doctor. So what do you think? Like, if people are double vaccinated, will they be allowed to sing? I don't know.
Yeah, I think the guidance that we've been using today is sort of a good starting place if you're going to, make an assumption. I don't know exactly how it might be modified, in particular on the issues of things like singing or playing musical instruments. One of the reasons we have been really cautious about those things specifically is because we know COVID transmits through droplets, including some large droplets that fall to the ground and some finer droplets that stay suspended in the air. And, if you're forcefully expelling air from your nose or mouth, then you're creating the conditions to spread more of those droplets more easily. And, there have been examples of, like, there's a choir in the United States early on in the pandemic where many members of the choir became infected. And there's thought about exactly what caused that. But of course, if you're expelling air as a group and breathing in air as a group, you can imagine that that creates ideal conditions for the virus to be transmitted. Maybe once we get to a broader community vaccination level, maybe we'll be able to say that it's okay to play musical instruments. It's okay to sing without any concerns. And eventually I think we're going to get there. It's just a question of when and exactly what the residual concern or risk is as we learn more about the vaccines and how they impact us.
Yeah, so it may be, it's again reinforcing that messaging around gradual steps. Let's not all get, let's not arbitrarily say after Labor Day, we're all getting in there and we're just going to sing our faces off. We need to just take gradual steps and be guided as we go. Yeah.
And to begin relaxing restrictions on some of the things that are lower risk before we relax restrictions on things that are higher risk.
Exactly. Right. Yeah. Now, for more on the individual side of things. So I've heard of people who will say sort of this kind of idea. This person I know is vaccinated and I'm vaccinated, and so we were able to have a visit. Now, I don't know what they did with that visit. I wasn't present, but there's sort of this ongoing assumption of certain things can happen because we're vaccinated. I hear that very casually sort of expressed. Well, we're all vaccinated, so it's all good. As ministers or as faith leaders or the folks that do sort of visiting people in their homes in the past or in hospital or in long-term care homes, what do you think? How is vaccination going to change any of that kind of conversation? And I guess we have seen in long-term care There was some announcement, I think, this past week around folks are able to hug again. Not that clergy or faith community leaders are all about the hugging, but what does that look like once you've been vaccinated?
So I think some of the conversations about being able to visit without concern while vaccinated comes out of those CDC guidelines again. Essentially, they came out, must have been, it's definitely some weeks ago, may have been a month or more ago at this point. They had guidance that said, if you are vaccinated, then you can visit with other people who are vaccinated, or you can visit with unvaccinated people if no one in that household is high risk for bad outcomes of COVID. Mm. And that was, of course, sort of a landmark shift in recommendations. That is not where we are right now in Ontario. But again, that reflects the higher levels of 2-dose immunizations in the US. And it also reflects, quite frankly, sort of the risk tolerance of the CDC and sort of the art piece as opposed to the science piece. So that's happening there in that context. They have much higher levels of 2-dose immunization, and they're talking about the kinds of things people can do if they've gotten 2 doses. In our community more broadly, we aren't at that place. Almost everyone who's gotten vaccine has gotten 1 dose. And we're not at the levels yet where we're able to say the things the CDC is saying. Of course, especially during this 3rd wave, we're in a context where social gatherings are discouraged, forbidden, and we're not going to be able to resume those until the lockdown period ends, and we're in a place where it's a bit safer to do so than it is right now. You mentioned long-term care, and that actually is a landmark decision. So the new guidance for long-term care and the new direction from the province essentially says that residents of long-term care who have gotten 2 doses of vaccine, who are fully vaccinated, can have contact, can have hugs, for example, with caregivers who they're seeing who have also gotten 2 doses of vaccine. And if you think about that, long-term care is its own unique context in that we have really high levels of vaccination among residents there and among the caregivers and staff in long-term care homes. In most cases, in almost all cases, really, the residents have had 2 doses of the vaccine. And even among people who've only gotten 1 dose, it's a much higher level of uptake than what we see in the broader community. And so that's a different kind of risk context than what we see in the broader community. And that is actually more similar to what we're seeing in the US, where they have higher levels of 2-dose immunization. I think the other factor is that there's really a strong awareness of the experience of people living in long-term care homes. Of course, there has been the experience of COVID and the infections that illness has caused, and the outbreaks and the direct health impacts and social impacts of the infections. But then there's, of course, the impacts of the restrictions, and the measures that are being put in place to limit the spread of COVID have a number of other consequences for the health and for the quality of life of people who live there. And people who live there have had to face an incredible burden over the course of the pandemic. And I think across the entire health system, we recognize that. And that was a big part of why people there were prioritized for the vaccine. And I think that there's a recognition that given that the context there is different, given that we do believe it is safer in long-term care homes than it was months ago, there's a recognition that there needs to be a balance to help improve the quality of life for people who live there, given that it can be responsibly done now.
That's great. Yeah, that's helpful. We talked last year, and one of the things I brought attention to was faith leaders have this role in the community based on the communities they serve to go to different spots. My day could include going to see somebody in person in their home, going to the hospital to visit somebody in hospital, going to a long-term care facility, doing a service, or visiting again. I think for some faith leaders, we're wondering a little bit of, and it's a bit about what Bruce was talking about earlier, about managing the expectations of our own community. Once we're at that place of both the community and ourselves being double dosed, there may be some who would have an expectation of faith leaders to return to that kind of activity. Your best guidance or judgment of is, I have some assumptions around that. Your best guidance around, these little faith leader vectors going from place to place to place, is that the best idea, or should we be managing that in a certain way? Any sort of thoughts or advice on that?
So I think this is where, we're going to see some guidance coming up to help us inform decisions and recommendations around that. I think that, as we get to a broader uptake of 2 doses of the vaccine as a community, we're going to be moving along that pathway from where we are right now to our normal. And, I think that being able to visit people in long-term care more like we used to is going to be part of that return to normal. Exactly where in the transition process that piece changes, I can't put much of a precise finger on it, but it's going to happen somewhere along that. And I guess more details to come as the guidance evolves.
Yeah, for sure. And again, it's that graduated pacing. So right now, and I'm going to wrap this into my sort of last question for you. Right now, when we're focusing on long-term care, it's really about caregivers and the resident having that opportunity to have more substantial connection for the sake of their well-being and mental health and all those things. It is Mental Health Week, as you're probably well aware, in Canada. And I'm wondering if you have anything to sort of offer related to, I think there's a lot of, I know for myself, I have this sort of residual anxiety. I see, on the news or pictures, or I hear from friends, I see gatherings, I see a variety of different things, and it sort of heightens my worry, and in our own communities, in these faith communities, there's going to be people who will want to gather, and there will be other people who will be actually resentful, angry, grumpy that people are gathering, both within those communities themselves, but also on the outside of those communities, just as we try to adjust. Do you have anything to offer in that sort of sense of around how we adapt or how we deal with this, residual anxiety or concern about the future?
I think that's a really great question. I think it raises the issue of, we, as the pandemic began, as you learned about the kinds of measures we need to put in place to protect ourselves and protect others, we went through a big learning curve, and we made changes to the way we live our lives. And, it's been long enough now in some ways that we have gotten used to those life changes. And we need to recognize that it's going to be another significant shift to go back. And there are going to be some people who don't feel comfortable going out without wearing a mask, even if they don't have to wear a mask anymore. They're going to feel uncomfortable being close to someone within 2 meters of them, even if guidance says it's okay to be closer to them. And they're not going to feel comfortable in those large gatherings. And that's going to be people's own internalization of their sense of risk. And it's just going to be a reflection of the fact that, we've been living through a collective trauma for the past year. And we have really, public health has been hammering away on these are the things to do. And it's not easy to roll that back and to undo that and to unlearn those things. And we are going to really have to get used to our new normal over time. And that's going to be okay. We have to give ourselves permission to do that. And I think that we also need to, as individuals, try and go easy on ourselves where we can, because I know that the pandemic has been very hard on people, and people have, in some cases, had a lot of anxiety and stress about their fidelity to the pandemic restrictions. And, it's not easy to do everything perfectly for 12 plus months. And while we have been saying these are all the things that are important to do, people also need to recognize that there are still things that they can do that public health is not forbidding. Like, we've been saying don't gather in person indoors, people outside your household, and so people have much less social connection. But sometimes people need to be reminded that it's still important to make the effort to connect, whether it's over a phone call or a Zoom call or some other mechanism. And once outdoor gatherings are allowed, that'll be a safer mechanism to engage with other people. And there are ways to gradually return to normal and to have that social contact, even before returning to the full normal. All this is to say is it's going to be a transition, and everyone's going to have to go through that transition in their own way. And really, it's critically important that people let themselves do that, go easy on themselves, go easy on others around them, try not to pass judgment on themselves and try not to pass judgment on those around them, because everyone's going to experience that transition in their own way. And, we're going to get out of this. We're going to get to a normal once all this is done. But there's still a lot of stuff that's going to happen before we get to that point. And we need to recognize the trauma that this has caused and allow ourselves to have some space to manage that without feeling too stressed about it.
Thank you so much. I really appreciate that. Yeah, that's a helpful way of thinking about it. I want to be faithful to your time, Doc. I know you're a busy guy. And is there anything else that we haven't covered that you would really want to just make sure that a message like gets out to the faith community that might be watching this later?
I think the only thing I'll say to kind of cap off, we talked a lot about vaccines during this talk, and that is the key thing that we communicate about because it's what's going to get us out of the pandemic definitively. And right now we are at a point where after having many months of really scarce vaccine supply, we're going to be getting more doses of vaccine coming in fast and furious to our community. And so we want to be able to get people in the door to get immunized as quickly as possible as those vaccine supplies increase. Right now, we have a pre-registration system for people in our community. And essentially, you can go to our website. And from our website, you can sign up so that we have your contact information. And as soon as you're eligible to receive the vaccine, you get notification. And you're able to then go in and book. And once you have your appointment, you get the vaccine. We recently expanded the pre-registration system so that it's now anyone who's age 12 and older who can sign up, because the Pfizer vaccine now, according to Health Canada, can be given to younger people age 12 and up. And so we're saying that even if you don't think you're going to get the vaccine this week or this month because you're further down the list, please get yourself signed up in that system so that as soon as your turn comes up, we're able to find you, we're able to contact you, we're able to let you know to come into our clinics. And we want to make sure that we have the ability to reach people when their turn comes up, because we'd hate for people to be waiting for their turn at home, not realizing their turn has come up. And meanwhile, our clinics are not working at full capacity. So we want to have everyone ready to go as soon as possible. And that means signing up through our system, which you can access through our website.
And I'll make sure that in the description for this YouTube video that we'll create has the link to your pre-registration for sure, to make sure that people get to that. I'll
send you that direct link so you have the crisp, clean version of that link.
Awesome, that'd be great. Dr. Tenenbaum, I want to really offer my appreciation on behalf of a variety of faith leaders in our community for your time and your willingness to connect with us. You offered this very generously. I didn't ask you to, but that was very kind of you, and I appreciate that, and appreciated our previous conversation. Probably we'll need to have another conversation later on just to have a better sense of things as this year evolves. But immense gratitude to you personally, to Dr. Mercer, and to certainly your entire team at Public Health. There have been times when you have completely outdone yourselves. We've been celebrated within the province as being ahead of some things. And we're just very grateful for the hard work that everyone is doing there and trying to keep up with things in this constant changing world. So thank you for your time, and thank you for being with us today.
And thank you as well for your time. I appreciate the chances to connect, and I find them very helpful as well. And it's just nice to have some back and forth conversation about what's going on and how it's being experienced, and then where we think we might be going next.
Yeah.
Thanks so much.
All right. Thank you.
Have a great weekend.